Easing the pressure. Managing performance anxiety in first-year SPE. Imagine you are a first-year Supervised Pastoral Education, or SPE, student. You've just walked into a hospital room for your first clinical visit. Your heart is racing, your palms are sweaty, and suddenly, you can't remember a single thing from your orientation. The problem isn't just nerves. It is performance anxiety, a common but often unaddressed hurdle in clinical pastoral training. Today, we'll explore what performance anxiety looks like in SPE, why it happens, and how both students and supervisors can manage it to foster a healthier learning environment. What is performance anxiety in SPE? In their article, Recognizing and Managing Performance Anxiety in First-Year Supervised Pastoral Education, SPE, students, description, causes, and remedies. Nazila Iskandarova, Thomas O'Connor, and Rhonda Kane define performance anxiety in the context of SPE as the fear of being judged as incompetent by supervisors, peers, or even the patients themselves. Symptoms of performance anxiety manifest as a fight, flight, or freeze response. Students might become overly perfectionistic, withdraw from group discussions, or feel a sense of existential dread about their ministerial identity. Nazila Iskandarova, Thomas O'Connor, and Rhonda Kane also discuss contextual pressures and factors that intensify performance anxiety. They give an example of the COVID-19 pandemic, which added layers of health anxiety and social isolation, while the multi-faith and multicultural nature of Canadian clinical settings. They noted that this kind of global, even local pressure can leave students unsure of how to provide culturally sensitive care. Why does performance anxiety happen? What are the roots and causes of performance anxiety? Let's look at the theology of Paul Tillich. Nazila Iskandarova, Thomas O'Connor, and Rhonda Kane draw on Paul Tillich's The Courage to Be. They suggest that performance anxiety is often a form of existential anxiety, the fear of not being enough or losing one's sense of self in a high-stakes environment. The authors also discuss clinical requirements and competencies that students are supposed to develop during their training. In this respect, they note that SPE is unique because it requires students to be vulnerable in terms of their self-awareness. You aren't just learning a skill, you are the living human document being studied. There are also psychological factors. For many, this is their first time in a professional, helping role. The pressure to perform a spiritual identity while being closely observed by a supervisor can trigger deep-seated fears of failure. Managing performance anxiety. The article suggests that students should, first, learn and practice self-compassion. Acknowledge that anxiety is a natural part of the learning process, not a sign of failure. Second, they need to practice mindfulness and use grounding techniques before entering a patient's room to move from performance mode to presence mode. Nazila Iskandarova, Thomas O'Connor, and Rhonda Kane also suggest that supervisors should practice normalizing anxiety. In this respect, supervisors should openly discuss performance anxiety early in the unit to destigmatize it. Supervisors should also create a safe environment. Creating a brave space where students feel safe to fail is essential for clinical growth. In sum, students learn how to emerge from anxiety to authenticity. Performance anxiety is an expected part of the first-year SPE journey. It stems from existential fears and the intense vulnerability of clinical work, but it can be managed through cultural awareness, supervisory support, and self-care. If you are a student, remember, your goal isn't to be a perfect minister, but a present one. If you are a supervisor, your most powerful tool is your empathy. By recognizing and managing this anxiety, we move from a theater of performance to a sacred space of healing. Thank you for listening. If you find this summary helpful, please do not forget to subscribe and share the video.